That nagging pain on the outer side of your elbow. This is what doctors call tennis elbow. Tennis elbow is a tendon problem where the forearm muscles attach to a small bony bump on the outer elbow. Despite the name, most people with tennis elbow have never played tennis. Repeated gripping and twisting are the real triggers. Repeated stress creates tiny tears in the tendon. The tissue weakens and becomes sensitive rather than truly inflamed. Common symptoms include a burning outer elbow pain, weak grip, and objects slipping out of the hand. Doctors usually diagnose tennis elbow with a physical exam. Ultrasound or MRI are used only when the picture is unclear. Most cases settle within 6 to 12 months with conservative care, activity changes, physiotherapy, and patience. Physiotherapy is the cornerstone. Progressive loading exercises help the tendon remodel and regain strength over months. When pain persists, doctors may consider injections. Steroid gives quick relief, but research shows worse long-term outcomes. Surgery is reserved for the small number whose pain persists beyond 6 to 12 months, despite thorough conservative care. The goal of surgery is to remove damaged tendon tissue so healthy tendon can grow in its place. After surgery, the arm rests in a sling for days, then physiotherapy begins. Full recovery can take up to a year. Tennis elbow can return if loading patterns don't change. Ongoing strength work and ergonomic tweaks protect the tendon. Did you know? You can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost.
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.